Welcome back to the Light Within show. I'm your host, Joan Jacobs. Today I'm talking to Dr. Mahesh Gandhi, an expert in the homeopathic treatment of psychiatric disorders. Dr. Gandhi, before the break, you were saying that you're writing a book about patterns that you discovered that could actually contribute to the prediction or evaluation of people who are more vulnerable to psychiatric conditions than others?
Yes, but this would not be the right subject for this particular audience. But what I've seen is last 30 years when I've been practicing homeopathy and with psychiatry. So I'm seeing that there is certain pattern, and this is what I would be writing, that it will help. Because homeopathy, we have so many medications. So when a homeopath reads the book, will know that there are certain type of personalities who are more prone to it, and then they will be able to help. Like, for example, we have to find out people who can break down. Like, for example, let's say if there is somebody is called by a police for whatever reason because they suspect him for some crime. Then there are some individuals, as soon as they are called by the police, they break down. They cry, they break down at the thought that they have been called. So when they have been given the notice that you have been called by the police, that is enough to break them down. Whereas when you go, sometimes there are some people who are very tough. And when you take them to the police station, you have to really use very difficult measures, sometimes even torture and whatever you might do to get the person speak what is inside his mind. So just like this, even within us, there are certain people who may be very strong and may not break down so much psychologically. Whereas some people break down. So there is a pattern. There are some people who are more prone for anxiety. There are more patients who are certain personalities which are more prone for depression. And this is what comes with experience, and which probably a good homeopath who has a more experience in this would be able to pick up those patterns.
Sounds very interesting. You know, another question I wanted to ask you is, homeopathic intake depends to a great extent on verbal communication. And I can only assume that some psychiatric patients may not be 100% coherent. How do you do the intake, and how do you classify their symptoms when verbal communication is not possible?
This is a very, very interesting question. I don't know how well I can answer it, but let me try. Let's take neurotic disorders like anxiety, depression, obsessive compulsive, phobias. Here the patient comes and talks to us. He is already at a deeper level. Because when you come with physical problems, a person comes, let's say, for psoriasis, lichen planus, or he comes for this asthma. And then we have to take the history and go into his mind and see what is going on in his mind and in his emotions and at a deeper level. My patients already come at a deeper level. They start telling, I have fear of death. Or they would say, I have this obsessive need to be very clean. So we are already at a deep level. So it makes my job very easy because they are already talking at a deep level. So tell me, how do you feel when you feel dirty? What is your experience when you feel that way? So I am already beginning at a much deeper level. Whereas somebody who has psoriasis, we have to bring him to the feeling that when I have psoriasis, I feel I am dirty. And then you have to go into... So my job is much easier. I'm already talking, we are already at the mental level, emotional level. Secondly, when we treat psychiatric disorders or psychotic disorders rather, like schizophrenia or manic depressive psychosis, bipolar disorders, patients talk about their delusions. They talk about weird things. Somebody is chasing me, somebody is behind me, they'll try to kill me, I'm being persecuted, I'm being followed. Now, in my opinion, these are not some symptoms which are coming from outside. These are not symptoms because he has got some aberration in the brain, so his mind is fabricating some symptoms. But I feel that because his ego has broken down, his deeper fears, his deeper delusions are coming out. We all have our dream state. We know that when we are dreaming, we feel that somebody is chasing us and we are trying to escape. Now, when I tell this in the day, I had a dream that there were some people were running, trying to kill me, and I was running, and then I could not hide, and then they caught me. It sounds very, you can say it because people will say, oh, we can understand because it's a dream. For me, psychotic disorders are nothing but dreaming with your eyes open. So all the symptoms what the patient is talking, all his delusions, all his inner perception of the world are actually his own, because the filter has gone wrong, because he cannot keep his unconscious within check. All that unconscious, his processes or his thoughts or whatever is there inside, deep inside his psyche, starts coming out in his conscious mind. And that is what we call as schizophrenia, because the border between the unconscious and the conscious has broken. It is like he is now dreaming with his eyes open. He does not have to dream anymore. And for every homeopath, dream analysis is a very important aspect of the case taking. So when I study a psychotic, for me, I just see that he's talking as if in a dream, because all that is actually him. Those were the things which were always there, but now they have crossed the border. They cannot be kept in check, and they are coming out.
That's interesting.
So it is it's not something. Before, when they used to come to me, I remember when I started my practice, let's say whenever, when the patient would come with all these psychotic symptoms, I would feel, how can I talk with this patient? I cannot talk with him because he's talking nonsense. So I would give them psychiatric drugs and medications and make him normal, and then make him talk, and then take his history and then give him the remedy. But now what I have realized is, when they come in an acute psychotic breakdown, that is the best time, because that is the time when he gives all his florid symptoms. He talks the deepest things. And we should not lose this opportunity. So in fact, my job is much easier, because it is like they are talking completely from their unconscious mind. And this is what we really need to understand when you treat the patient. You know him the best when he comes in psychosis.
But I guess you would need a lot of experience to recognize that it is a psychotic condition.
No, so psychotic is very easy to know. It's very simple. It is one who's not in touch with reality. If he says things which nobody agrees with, if he does things which are stupid, if I start putting some cap in my head and start walking and say I am a king, it is psychotic, because nobody around will agree with it.
Oh, I see.
So when you think, feel and behave in a way which is very inappropriate to your surrounding, then nobody agrees and validates what you do, then it is psychotic. So we have delusions, we have hallucinations. I start hearing things which nobody else hears, or I start believing things which nobody else believes. So that is psychotic. But what we would like to do is, very often people who are mildly psychotic don't even talk about their delusions, because they feel they will be ridiculed or people will not believe them. But when they come to me, I make them talk and I really show interest in that. And then they feel, oh, there is somebody who's ready to listen to all what others are not ready to. And that's where I get the remedy from.
Yeah.
And this is what it is, because that is his reality. We have to go into everybody's reality. When we go deep, we realize that we all have our own individual reality. We are living in two worlds. One is our human life. When we are outside, everybody knows me as Mahesh Gandhi, but I have my inner reality. We see these split people and split personalities. Schizophrenia is split personality. That is the definition. It means that you are living two realities. One which is the external, which is Mahesh Gandhi, and I might say I am Jesus Christ, which is my another reality. Do you understand? So there are two. So we have to understand. And the remedy is based on your inner reality and not your external reality. So when somebody, Mr. X, comes, I'm not interested only in Mr. X. But what is he experiencing life? It's like, you have another inner reality. And that is what makes you peculiar. That is what makes you different. We are all human beings, but then we are all different too. But what makes us different is our inner reality, which is very different. And this inner reality is what we share with many things in the world around us, whether it be from the mineral kingdom, plant kingdom, or animal kingdom, from which we make our remedies.
Which brings me to ask you about your work with Dr. Shankaran and the way you apply the vital sensation approach, because that's actually what you're describing.
So this is yes.
The main experience, the main sensation.
Yes. But this is exactly how we describe men or people, human beings, we say, oh, she's like a cat. Oh, he's so snaky. Very often we use these type of terminal. That means there is something peculiar in him like a snake. Oh, he's cunning like a fox. Or sly like something else. So this is what we notice. We all observe this. But there is some truth in it. It's like we have two realities. We have a human song, which is an external song, but at a deep level, we are experiencing this world through the eyes of something in this universe. And that makes us different.
But you're also saying that it takes knowledge to know how to listen to the language people speak and to know how to translate what they're saying and with their body movements and their expressions.
Yes. Exactly. So we are seeing how is he different? What makes him peculiar? In what way is different? Modern medicine wants to know what is common. And in allopathy, homeopathy, we want to know in what way is he different? What peculiarizes him? What individualizes him?
Yeah. Yeah.
It's like that is important. And that will tell you what is his inner story. That inner story is little different. In all of us, there's a different inner story. It's like, why am I in this universe? If you take something like, let's say, a spiritual question, why am I this in this world? Maybe I'm experiencing life through something in this world which is teaching me. So I'm experiencing probably through the eyes of a plant, or maybe through there's something. We have these cards, animal cards, plant cards, people who have these tarot. That means there is a message. Every plant has a message. Every animal has a message. So we are living through that. I might be a lion inside. I could be an eagle inside. I could be some plant and showing the sensitivity of that plant. And it is not a pathology. It is in a way experiencing life through it and making our life richer and making us all different and make it so wonderful, this world.
But actually what you're saying is that very fundamental energy, which is connected to a component in the universe, that's the individualization, and that's what needs to be identified.
Yes. So at an external level, we are human beings, but as we go deeper and deeper, we see that we share a lot in common with the universe around. Yes. And then we still further go deeper, then you are your spiritual, blissful self.
Yes.
So somewhere this homeopathy shares the Eastern philosophy, which has more to do with religion vis-a-vis the West, which is more science-oriented.
And it's also much more spiritual.
Yes. Well, of course, now everything is changing. We are getting into this global village, and we see that now the West and East, this demarcation is not holding anymore, and we are becoming more and more as one.
That's true. Well, we're going to take our last break, and we'll continue talking about that right after the break. Stay tuned with us. We'll be right back.